Good evening. I'm Dr. Johnson, your host. I'm a board certified dermatologist, and we're going to talk about our topic in a few minutes, waiting on people to join us. If you want to share the screen, just press the button at the bottom of the screen. Sharing is caring. And if you have a friend you want to share this message with, just tag them. Okay. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Today we're going to talk about anti-aging products such as exfoliators. So exfoliators is a group of products. It could be either chemical exfoliation or physical. So chemical exfoliators really includes your chemical peels and products like retinoids, which is what I spoke about yesterday. So chemical peels could be your beta hydroxy acids or your alpha hydroxy acids. And basically how they work is they interact with the lipids that are in the skin and dissolve the lipids and therefore causes loosening of the skin and exfoliation. So the problem with chemical peels, you want to make sure they're not too strong. So I highly recommend seeing an esthetician, someone professionally trained to work with chemical peels. Of course, there's also doctors' offices such as plastic surgeons or dermatologists who hire estheticians, as well as the doctors themselves can be best to help you with that type of treatment. Now, how often do you perform the chemical exfoliation? If you do the chemical peels, I recommend them with the higher strength chemical peels, maybe once every 2 weeks as the earliest, and otherwise on average once a month. You do not want to do them too often because if you perform this frequently, you will notice you will cause irritation, which we call irritant dermatitis. So you do not want to have this procedure done too often. And again, you don't want the irritant dermatitis or just severe dry skin. And when you put on your other products, you have dryness and burning sensation. So if you experience that, that means you're doing your exfoliation too often. So besides the chemical peels, like I said, I mentioned retinoids yesterday. And as you notice, retinoids include Retin-A or retinol, which is over the counter, and your Retin-A is a prescription. Those are exfoliation products also. However, they're performed, you apply those every day and you leave them on. Unlike a chemical peel, you rinse off after so many minutes. So that's another option. And again, when you're using those products together, you want to stop your retinol, Retin-A's a couple of days before your chemical peel and do not resume them for a couple of days after. We recommend 3 days, but again, 3 days before, not using your retinol or Retin-A, and then after your chemical peel 3 days after. That's when you can resume if you feel like your skin is up to doing that. When you have chemical exfoliation, you would notice that some people have more peeling than others. So if you tend to peel a lot more, that's not a bad thing. If you don't peel that much, that's okay also. It's just that, again, you're going to continue to do this on a periodic basis. And so when you do that, you'll start, a lot of times the esthetician or whoever is performing the procedure will increase the concentration based on what you can tolerate. Now, what I always tell patients or clients is when you do this procedure, if you can only tolerate a 10%, that's all you need. Just because there's a 70%, in the area, that doesn't mean you need to get to 70%. So if your skin can only tolerate 10, that is going to work just as well as someone who can tolerate a 70%. So do not go by the strength, you go by what your skin can tolerate, especially at the time. So just keep that in mind. Now, as far as that's your chemical peels, your chemical exfoliators. Like I said, your chemical peels, as well as your retinoids. Those are very common chemical exfoliators. Now let's talk about the mechanical or physical exfoliators. Those are more your natural products that you can do. So you can either get a facial scrub. It's usually like a little sponge that's one side is soft, another side is a little rough. And again, when you use that, you want to clean your face and rub in a circular motion. So that will help exfoliate the skin. And all you're doing is just, again, lifting off the dead skin. So that's a physical exfoliator. Again, a natural product that you can use, which is just the sponge itself. Also, there are sugar scrubs, and some people actually grind up walnuts to make a walnut scrub. So there are various types of physical scrubs that you can do, or exfoliators that you can have. And another one could be, besides the sugar scrub, it could be your pumice stone. Grind it up in very small particles and put into a paste. And you can put that on, apply water as needed, and keep rubbing in a circular motion. That will also help exfoliate. So there's a lot of different products on the market that you can use that are natural, and it will not cause any irritation such like a chemical peel will. But again, you just need to make sure it's not the scrub, in this case a physical scrub, that really will cause a problem as much as the products you use with it. So you want to make sure after you exfoliate your skin, the products you put on that you leave on are not too harsh for your skin. Meaning, if you don't use the scrub at all, any type of scrub or exfoliator at all, and you put this, let's say your moisturizer on, you have no problems. But now all of a sudden, you're using an exfoliator, and the same moisturizer you've been using for a couple of weeks now is burning your skin. That doesn't mean something's wrong with your moisturizer. It means you use an exfoliator that you may want to try a different moisturizer to apply after your exfoliation, or just not exfoliate as often. So just keep that in mind. And so I really recommend when people start a new skincare regimen, do it one step at a time. Don't be too aggressive. Meaning, don't get all new products along with trying to scrub, because you have so many factors that are playing into if you have a bad outcome. So do one thing at a time. You know, if you have a product line you want to try, you know, start off with just a cleanser and keep using your old products. And then as after a week go by, you have no problems with the cleanser, then add on the other product. So just do it in a stepwise progression. So number one, your skin can get used to the changes of using this different product. But number two, if there is a problem, then you can figure out what's causing it. And not to say that every time you use a new product that you have irritation with it, that means you're allergic to it. It could mean at this time, with these other products, this is not the right product to use at this time. So again, this is where talking to your doctor, if you purchase these products from a doctor's office or your esthetician, you want to let them know what's going on so they can help you decipher what is best for you and your skin. Any questions? Well, hello, Miss Tate, and hello, Jocelyn. Hello, Dr. Myers. I'm sorry, Dr. Myers. Hello. Okay, just making sure. Anyone have any questions for me? Okay, no questions. Well, again, thank you for joining me. Okay, perfect. Thank you for joining me, and I'll see you tomorrow. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson. DrSonyaJohnson. Take care and good night. Thank you.